Doesn't matter. All I'm telling you is you did some activity that kept that right low trap and right tricep on. Jonathan, I don't know what it was. Could have been just your sleep. If all the tests are negative, you do something on that right low trap, right tricep program, which, Jonathan, we're going to do once we get through this next algorithmic step. So I could stop right here. I could pick something out of that right low trap, right tricep program and say, Jonathan, would you go home tonight and do these 2 exercises? These 2 non-manual techniques. Kurt, he would have came in today and he would have been possibly what? Neutral. It worked. Or you could have came in today, or you could have done those 2 techniques, and some of those tests still remain what, Kurt? Positive. It looks to me like we've got a problem somewhere. For some reason, that right low trap program I gave you last night didn't keep you neutral. Folks, that is more likely what's going to happen. Probably what, Mike? 80% of the time? Okay. What do you guys think? 90% of the time, depending on the day? Jen, what do you think? A lot more than the other. Because, people are not going to ever take, they haven't had the chance to do this yet, Kurt. They're sitting there for the first time saying, you mean it doesn't naturally do a right low trap and right tricep program, and you're telling me that there's no guarantee that I'm going to walk out of here being neutral? And the answer, Kurt, is yes, there is no guarantee you're going to walk out of here with a neutral position or all tests being negative. Yes.
So let's say he's your patient and he went home and did a couple low trap, right tricep exercises, and he came back as we saw him today and he was neutral. Is that the end of the exercises?
No, we're going to say, hey man, nice job, buddy. Now we're going to advance you. Now we're going to get you, we're going to do some more activities that are going to reflect what I really need from you. What do you do for a living? What's your biggest challenge? What do you habitually like? What's your passion? And I'm going to keep pushing them if I can, because I'm going to get them strong. And this is not a Mile King course. It's a postural course. I'm going to really make sure he understands how to integrate what abdominal wall, Linda? His left abs. I'm going to give him more and more and more integration with his left abs. And he gets to a point and he's saying, I'm pretty cool. I can do this. I can breathe when I work with my left abs. I'm probably done with him. I'm going to get him upright. I'm going to see if he can handle one leg as he rotates his trunk and breathes and sings the Star Spangled Banner. I'm going to get him really good, stable on the left side, but it won't take much. Now, Linda, if that happens, you had a lucky soul that day. It doesn't happen that way. And in my world, because I usually am used as a consultant, I see people that need more things besides this. But I can't give those things to you. Mouthpiece, foot orthotics, different glasses. I can't give those things if you didn't go through this. Because you got to convince me you've done something to keep that right low trap on. That right tricep on. The right tricep is like your left hamstring. It keeps you repositioned. The right low trap is like your hamstring and your adductor on the left side. Keeps you repositioned. Good question. Because if he comes back and he's neutral, we can have fun. I can actually become a PT again. I can actually think about the word strengthening and stretching. And hope you don't fall apart. That makes sense? Because now I got what I thought I had in school. A neutral body. I never had a neutral body in school. Are you serious? Do you follow me? Now I can start that up and I can say, hey, gotcha. Gotcha. Mike, you and I have a patient that didn't have a neutral body. He thought he had a neutral body. PC kind of a guy. Took a little active guy, a lot of Hail Marys and Our Fathers, and we finally got the guy to what? He did his exercises. He's a great guy, actually. And this strong PC man became neutral. And he can adduct. And he can rotate. And he has mediastinums. And we had to do some glasses to get him there. And he got some good feet with some good shoes on him. This guy did a great job. Neutral. His back still hurts. Middle of his back is still killing him. There's something going on with his back, right, Mike? We've done our work. We've done everything we can. He can flex. He can touch his toes. He can squat. He's an old wrestler. He's brawny. His back still hurts. So Mike, we know we got to keep looking at that back. He's still compressed. There's something going on with microtrauma to that vertebrae. There's something going on with his mid-back. Doc, help us. We don't know that he shouldn't have any back pain. He has it. We believe him. He's married to a, is she an ENT? No, she's married to an internal medicine. Isn't she an internal medicine?
Family care doc.
Okay, well, so she's married to a doc. So I'm using that story to make sure you understand that as a therapist, chiropractor, trainer, I'm going to do everything I can to keep that body what? Neutral. And then we get that program to a certain point and they still hurt. We have all the reason in the world to take the next step, whatever that might be. Whatever that might be. Tests come back. He comes back this morning, and doggone it, you aren't positive. You aren't neutral. You aren't negative. You're still what? Positive. So on that side of your sheet, it says all or some of those tests remain positive. All right? Jonathan, are we still good? I'm now going to show you a technique called the Superior T4 manual technique. And I'm going to get into it by showing you what is it. We're going to call it the Superior T4 conditioned. And you got about 4 or 5 pages in your manual that's going to talk about this, because this is about the brachial chain right now. This is brachial chain. So we're going to do the brachial chain technique right now. It's on page 47. Jen's going to read it. I'm going to demonstrate it. And what we have here with the Superior T4 syndrome, I'm going to discuss with you before we do the technique. And that is on, I believe, that is on, I'm going to go over all the, I'll just follow the diagram. Let's just tell you what the Superior T4 technique does. It lengthens the right anterior brachial chain soft tissue. We want to get opening back here on the left side. And to do that, we're going to start with opening the front on the right side. We want to get this chest wall from this sternum where my finger is to this glenoid where my other little finger is to expand. We're going to try to get opening of that chest wall. Because then you might have all the ability in the world to get neutral during a right low trap and right tricep. Now this is not the Superior T4 is not a condition, it's a technique at this point. At this point, it's a technique. So Jen, would you mind reading that and we'll demonstrate it? And here's where I believe this table over here is going to have to clear. So we're going to come down here, you'll stand around, we'll demonstrate it, we'll show you what it does, you're going to break in lab, and you're going to actually do it on each other. Because for me to go any further right now, test on what we're going to do once we do that is ridiculous until you know what we're trying to do. Let's review. What's the number one manual technique for a right BC chained up individual? What's the number one manual technique? This particular technique. This is called the Superior T4 manual technique. Okay? This is where we're at, Jonathan. If you would have came back today and you would have been positive in 1 or 2 of those tests after I did the left AIC technique. All right. Good?
Superior T4 manual technique. This is a treatment technique for the right BC patient and also an assessment tool for Superior T4 syndrome. The test is HG internal rotation. We've already tested that. The position, the patient is positioned supine with knees supported in a 90-90 position. Operator at the head of the patient, left hand on the left upper chest with the little finger to the left side of the sternum. Right hand on the right upper chest with the thumb parallel to the clavicle. Move right palm over or closer to axilla or shoulder if needed. On inhalation, upon air in, the operator guides or pulls right chest up and back with the right hand and secures the left chest with the left hand. On exhalation, upon air out, guide or push the left chest down with the left hand as you secure the right chest with the right hand.
So if you all hold up your hands, because you're going to do this here in a few minutes in lab. We're going to go right into lab after this. Take your hand, take your thumb, and put your thumb directly underneath your second finger. And make a straight line with that thumb and finger. Your thumb and your index finger on the other hand should be lined up parallel with each other. So you got a thumb and a finger directly lined up over each other, and a thumb and a finger parallel with each other. Everybody do that? Very good. Then take your hand and come down onto your patient. Then, on air in, this right hand is going to be distracting and guiding air in, Stephanie, and I'll hold him. Then on air out, the left hand is going to be guiding and directing the other rib cage down towards that pocket. This is a direct reflection of what we just got through doing with the sternal technique before lunch. This is a sensitive hand, Kurt. We want to be careful with this hand. The hand that's going to make this person anxious is not this hand. The hand that's going to either relax or make this person more anxious is this hand. Therefore, doing things like that is not advisable. But doing things like that is very advisable. I want this chest to move into this palm. And I'm trying to get him to do that with his left diaphragm being the main muscle to direct that air on that right side. That makes sense to everybody? So we're going to go ahead and treat him, and then we go back to our lab here in a minute. I'm not worried about, I'm never worried, I don't want to spend time on checking whether or not all tests are positive or negative, because this is a lab session. Use the body, use the expertise around you to learn the technique. I'm guiding you on what to do. That's for us to decide later. Right now, learn the technique. So I'm going to dampen my hand. If he had more hair, I probably would put this entire towel on him so I didn't slip on the hair. Or if the skin was oily, I would use a towel so I wouldn't slip. This is not a myofascial technique, although, Tyler, it could be considered by some to be a myofascial technique. But this is an expansion technique. So I've got my hands a little moist, and you can tell that, can't you, Jonathan? Mm-hmm. And I'm going to bring his arm out here a little bit, because remember, if I could, I'd cut the appendage off or dislocate it and put it in the corner for now. Because all I want is this thorax, Brianne. So here we go. There's my thumbs parallel with each other. There's my index finger and my thumb lined up. He's going to take a nice breath of air in through his nose. So am I. We're both going to blow. My left hand moved down. My right hand did not. Already look at the distance between my two fingers. I'm going to hold it, right, Jonathan? I'm going to hold it. Mm-hmm. Breathe in. Jonathan, you can talk here. Which hand did you feel did most of the work on when you breathed in? The right side. Jonathan, blow out. Jonathan, which hand did most of the work on air out? The left side. Breathe in. I did not take my left hand off that chest wall. Blow out. And I have not slipped on this man at all. Have I, Jonathan? My finger's right where it was.
Right. Has not slipped.
I'm now at 4 inches. Breathe in. He just gave me another inch. Blow out. I still have not slipped on this gentleman. Now I'm at 5 inches. You all getting the idea? He breathes in. That was probably a ½ inch. He blows out. There, Jonathan. That's 6 inches. You guys want to get a measuring stick and measure, it's going to be close to 6. Jonathan, do you feel what's happening here?
Yeah, kind of.
What's opening up?
My lungs?
On the front, on which side? The right side. Everybody see that? And when I take my hand off, we just expanded that right chest wall. And we're going to recheck the test results after you do that.